You have been designated as the administrator for your healthcare practice group. The link you received via email will bring you to this landing page where you may set up the account for your practice group and fill out the questionnaire by first entering the email address to which the link was sent and then setting a password. The first section is about your practice group. Some of the information has already been entered. Please review and edit as necessary. Please enter your mobile number. Your mobile number will not appear anywhere in the app or website and will not be shared. It will only be used if we should need to employ a two-factor identity verification. Select the box that indicates who and how insurances/payment options are accepted. Is it that the practice group decides for all, individual clinics decide, or that in some cases individual full-time or part-time physicians decide? Each location where you provide healthcare services should be set up as an individual clinic. Enter the name of the clinic/location, the address separated by commas, including the city, and the phone number for scheduling appointments. If this clinic is able to converse with prospective patients in either Spanish or Haitian Creole, select the corresponding box. Select what attendant services are located with that clinic. If you provide a service that is not on this list that you feel should be listed, check Other and type it in. List all appointment types that are available at or through this clinic by one, some, or all of the healthcare providers. You may list keywords that you believe differentiate this clinic from other healthcare providers or that will be of particular interest to potential patients as they search for a healthcare provider. For each clinic, set the office hours. You can set the same hours for all days, Mondays through Fridays, or weekends. You may also edit individual days. So, for example, if the office is open Monday through Friday but has shorter hours on Friday, set the hours for Monday through Friday and then afterward edit just Friday's hours. For now, you are the trusted administrator for all clinics. Later, after everything is set up, we will give you the option to designate others to manage the information for individual clinics. For each clinic/location, you are asked to list the full-time and part-time licensed healthcare providers, starting with full-time physicians. If there are none under a particular category, delete that block of questions. We request you provide the physician's mobile number. Their number will not appear anywhere in the app or on the website and will not be shared. It will only be used in a case where the Florida Department of Health in Monroe County deems it necessary for direct communications, such as in the case of a disaster of some form. From the drop-down list, select their primary field of medicine and their secondary field of medicine if they have one. If they don't have a secondary field of medicine, select none from the drop-down menu. You may add specialty areas. For example, surgeons are often very specialized. Check this block if the physician is accepting new appointments. Otherwise, they will not appear in any search by prospective patients. This selection can also be used to temporarily disable a physician's availability, such as when they are on vacation or taking a sabbatical. To add providers to any section, select Add New Provider. Similar to full-time physicians, add all applicable full-time licensed staff for each clinic/location. For all physicians that are part-time or those who divide their time between different clinics/locations within your practice group, list them here. Since their availability differs from the set office hours, the days and hours of their availability must be individually set. This is covered in a separate tutorial which we have enclosed. Likewise, list all applicable licensed healthcare staff for each clinic/location. Be careful with this button. It should only be used if, for some reason, you wish to delete an entire clinic and all associated physicians and licensed healthcare staff information. If you wish to add a clinic/location, select this box and a whole new section will appear. For each entity that decides what insurances/payment options will be accepted, a menu compiled from the information submitted by all access to care participants will be presented. If the practice group decides for all clinics/locations, only one listing will be presented. If individual clinics/locations or even individual physicians decide, insurance list selections will be displayed accordingly. The selection list is divided into groups. Within some groups, it would be too cumbersome and of marginal value to potential patients to get too granular. So, for example, within commercial insurance plans, if your practice group accepts an HMO, PPO, POS, or EPO plan from a particular insurance company such as Aetna, just select Aetna, even though there may be one or more of the variants that you don't accept. If we have missed anything that you feel should be a part of this listing that isn't, or if you accept an insurance or payment option that isn't listed, please enter it here and we'll do our best to improve the access to care listing. Anytime while you are completing the questionnaire, and especially before you sign out or take a break, save your setup. Otherwise, your work may be lost.